and welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. The endocrine system is a network of glands that produce and release hormones. When people think about hormones, they probably think of the most common male and female hormones, testosterone and estrogen. However, children as well as adults produce many other kinds of hormones that affect every aspect of our health. Hormonal imbalance in children can cause serious consequences, and the burden and pattern of pediatric endocrine disorders are increasing worldwide. Accurate knowledge will help parents to recognize the symptoms in time and also to consult a doctor accordingly. Today, we've invited eminent endocrinologists to provide medically accurate advice on preventing various endocrine conditions in children and help viewers identify long-term control strategies. We're joined by Dr. Karthik S, a consultant pediatric and adult endocrinologist, Silverline Hospital, Kochi. Dr. M V Sekhar Reddy, Abhiram Endocrine and Skin Center, Hormone, India. And Dr. Suhas Khaire, a consultant endocrinologist, diabetologist, Noble Hospital, Pune. Thank you so much, doctors, for joining us and, creating awareness about this very important issue. Dr. Karthik, I'd like to start with you. If you could explain to the viewers what is the role of hormones in our body and how do they work?
Yeah, thank you, Ms. Gargi, for having me in. See, basically hormones are nothing but chemicals or substances that are majority ways it is a protein, but certain times it can also be something called amino acids or steroids. They work by traveling throughout the body and acting in various tissues throughout the body. Basically, they regulate the metabolism in the body, meaning temperature, the hunger, satiety patterns, and they are also helpful in regulating calcium levels, glucose levels and sodium levels. They help in maintaining BP, and they are also important for reproductive functions.
Reddy, what types of endocrine disorders are common in children and are these serious disorders?
Good afternoon. Thank you for having me here. Common endocrine disorders we see in children are diabetes and hypothyroidism, and growth disorders like short stature, and as well as puberty disorders like precocious puberty and delayed puberty. Usually diabetes, previously used to see commonly type 1 diabetes, which happens due to the absolute deficiency of insulin, a hormone called insulin produced by the pancreas, where the child will be presenting with a rapid onset of increased thirst, weight loss, and increased frequency of urination. So these symptoms should not be neglected in a child. We definitely need to check blood glucose immediately if the child is having these symptoms. Apart from these common endocrine disorders, there are some rare disorders which are serious, like disorders of sexual development, where we need to examine the genitals of the child so that the bearing on the sex of rearing will be looked after at the earlier and the orientation of the child can be made. Not only this, we also have an entity called eternal crisis, which may present at the time of birth. So these also need to be seen. These are all the serious disorders.
All right, Dr. Khaire, the hormones are essential for regulating most major bodily processes. So a hormonal imbalance can affect many bodily functions. How do hormones affect a child's development?
So if you see the child's development and growth, most important hormones, if you look, they are pituitary growth hormones, which is important for the long bones growth and the stature of the child. So that is important for height. Then comes the thyroid gland, which secretes two hormones called as T3 and T4. And these hormones are very important for the metabolism, for the brain development, for the stature also. Then comes the important hormones, which are the reproductive hormones, which governs the reproductive system. In the males, we see the testosterone, which is produced by the interstitial cells of the testes, and it helps in the genital development and pubertal development. Likewise, in girls, there is hormones called estrogens, and they are secreted by the ovaries. They are helpful for also the pubertal development and the other development and the breast development and all rest of the pubertal development. So when the child has a deficiency of one of these hormones, like if there is deficiency of growth hormone or thyroid hormone, they may present with the short stature, maybe the developmental delays, they may have learning disability in thyroid hormone especially, and also the mental retardation. In growth, in gonadal hormone deficiency, that is maybe the estrogen or testosterone deficiency, these children present with the delayed puberty signs. So they will not develop the pubertal changes at time what they should develop. So these are the common symptoms and common diseases usually we face in our clinical endocrine practice. Thank you.
All right. Now, Dr. Karthik, what causes growth hormones deficiency and how is growth hormone deficiency diagnosed?
Right. See, growth hormone, as has been already illustrated by Dr. Suhas, it's produced from pituitary gland. So when we look at problems caused, usually we classify into two categories. Ones which are congenital, that is, which are present from birth. So usually these are genetic conditions, and certain times it is not only growth hormone but also other hormones that are present in pituitary, like thyroid hormone and the hormones required for puberty. All these get affected simultaneously. So this is the most common variety called congenital type. And there is also something called acquired type, that is, a child can acquire growth hormone deficiency while it grows, usually in early or mid childhood, because of several problems like sudden history of infections to the brain, or sudden trauma, head injury, fall, or certain times there are certain tumors that are prevalent in younger age group that can also be manifesting as growth hormone deficiency. When you look at the diagnosis of growth hormone deficiency, it is a combination of symptoms that is manifested by the child and signs that we observe as doctors observe for, and the laboratory investigations. All these put together helps in proper diagnosis of growth hormone deficiency. And at this juncture, I'd just like to highlight that just doing a growth hormone levels and diagnosing growth hormone deficiency is not appropriate and not the right way to proceed on. So when we talk regarding the symptoms of growth hormone deficiency in neonates, that is in a baby that's born, usually the deficiency is manifested as prolonged jaundice or low sugar levels. And as the child grows, usually the growth deficiency is manifested because the child is compared with the peers. And especially when children are enrolled into school, there is good comparison by the parents with respect to peers, and they would notice that their child is not growing. So this is pretty important. This plus there are certain signs which we look for as markers of growth hormone deficiency. When such suspicion is high, we do laboratory testing. Initially we do screening, and then we confirm with other blood tests, and finally we do imaging, that is MRI of brain, to confirm the diagnosis of growth hormone deficiency.
All right, Dr. Reddy, growth hormone is needed. We're speaking about it, but it's also needed to stimulate the growth of bone and other tissue. So how do you activate the growth hormones in children?
Apart from its action on bone, it helps in the linear growth of the body, so that a person will grow tall. Not only it helps in the linear growth, but growth hormone is essential for circumferential growth. As Karthik sir has told, we need not diagnose growth hormone deficiency simply by doing the single growth hormone level. What happens normally is, except in patients with deficiency, we will not supplement exogenously. Normally what happens is, around 70% of the growth hormone is released physiologically during the night times. It is at the slow onset of sleep. That is during the phase 3 and phase 4 of sleep. And apart from it, when we do fasting for at least 10 to 12 hours, these are the physiological factors like sleep, fasting, and as well as exercise. These factors will help in the release of growth hormone. Apart from this, growth hormone we usually activate by giving some drugs for doing the testing of growth hormone deficiency, as we need to stimulate the hypothalamus, growth hormone releasing hormone to see whether there is any sufficient release of growth hormone. We give drugs like arginine, clonidine and glucagon to see whether the growth hormone is stimulated and identify the growth hormone deficiency. I would like to add one point that every child, we need to check height at least every 6 monthly, because what we see routinely in our OPDs is only weight has been being checked. We need to check the height also at least 6 monthly and plot on the growth chart. And if there is any deceleration of the height, or if the height is static, or if the height velocity after the age of 5 years till the puberty is attained, if it is less than 5 centimeters, as I told, if there is any deceleration, these are the factors that should suggest that the child is not growing adequately, and they should immediately meet the doctor for the poor growth.
All right, Dr. Khaire, thyroid disorders are also common in children. What causes hypothyroidism in children, and what is congenital hypothyroidism?
Yeah, I think that is a great question. As all we know, hypothyroid disorders are very common in adults, but also they are common in children as well. In children, most of the time, the common etiology is nowadays is called as autoimmune hypothyroidism. That suggests our own body's immune system acts against our thyroid, and it just destructs our thyroid, and that's why the thyroid hormone production becomes less. Other causes like maybe the pituitary hypothyroidism, or what we commonly call as central hypothyroidism. As all we know, the pituitary controls your thyroid. So whenever there is a problem in the pituitary, there could be a problem in thyroid also, and that's why that is one of the rare cause, but that need to be suspected. There are some medication that also can cause this hypothyroidism. If we go to the congenital hypothyroidism, this is I think we need to stress on congenital hypothyroidism. It is a very important entity, and if we don't treat properly, we can get the devastating complication like decrease in the height, decrease in the mental disability. All these are the devastating complications. So what is actually a congenital hypothyroidism? It develops due to the not development of the thyroid gland, what is called as the thyroid agenesis or thyroid dysgenesis. There are some other causes like dyshormonogenesis. What it means that the proper functioning of the hormonal machinery is not good, and that's why the hormone production is less. So these are the few 10 to 15% patient may have dyshormonogenesis. So in that case, we may need to see the family history of the patient also. This congenital hypothyroidism, if you look at the prevalence or the incidence in the community, it is 1 in around 2,000 to 3,000 live birth babies. We may get one congenital hypothyroidism. If we go to the symptoms, how we usually diagnose this patient. So congenital means it is present at the birth. So when if we look at the symptoms, many a times when babies born with congenital hypothyroidism, they may look absolutely normal. They may not have many symptoms. So the ideal way, we should always screen this patient with the blood sample at the birth or after 72 hours of the life, and then this we can screen these patients. All difficulties. But these symptoms is very difficult to differentiate between some normal babies also, because in the early age group we may get all these feeding deficiency difficulties also. So that again highlights the importance of screening of the congenital hypothyroidism. Other symptoms like the baby may feel growth may not be that great. They may have the constipation for a long time. They may have cold extremities. These babies sometimes are very much hypotonic, or what is called as a floppy baby. Their body muscle tone is less. So these are common symptoms of hypothyroidism. But as I mentioned, many of the times we may not get the obvious symptoms, and that's why screening is important. Why I'm stressing more on this, because if we treat this patient with the if early treatment is initiated, all these complications we can avoid, and we can achieve the baby's normal height. We can near normal height. We can achieve their normal intellectual potential also. So this is one of the disease where we can initiate early and we can avoid these long-term complications.
All right, well, we'll slip into a short break right now and return with more questions for the doctors. Do stay with us. Welcome back. You're watching Health and Wellness, and we're talking about hormones and health. Let's go across to our doctors. And Dr. Karthik, how common is early onset puberty, and what are the causes of early onset puberty?
Right. So early onset puberty is actually pretty rare, but before we delve into it, we'll have to understand what is puberty and what is early onset. It is actually defined in a girl when there is development of breast before the age of 8 years, or when she has menstrual periods before age of 9 years, and in boys development of reproductive organs before the age of 9 years. So it is pretty common in girls when we compare with boys, and the most important cause in the majority of cases, it is what we call as idiopathic. There is no specific cause behind that. And of late, we have been seeing that several girls have been going on to early onset puberty because of several changes in our lifestyle and because of several factors, what we call as endocrine disruptor chemicals, that is presence of microplastics, lots of air pollution, the polluted water which we drink, and so on and so forth. Second important epidemic that is going on is obesity. So because of these two major implications, several girls are going into early onset puberty. And when we look at the exact causes, as I had said, majority are what we call as causeless, idiopathic. We don't find a specific reason. But generally, we classify the causes according to problems pertaining to brain and pituitary, problems that are not in brain. So when we look at the problems in brain, it can be because of certain infections or certain developmental problems or certain trauma, that is injury, head injury, or rarely tumors also that are present in the brain. And when we look at the other causes for early onset puberty, that is other than brain, there are several endocrine organs that can produce male or female hormones, especially reproductive hormones, reproductive gland organs. But apart from that, even adrenal gland or problems related to adrenal gland can also manifest as early onset puberty. Rarely, there are certain genetic conditions that can affect several organs like bones, skin, that can also cause early onset puberty, and even severe thyroid problem can also land up in early onset puberty.
All right, Dr. Reddy, now staying with this issue of being overweight, does being overweight lead to early puberty?
Yeah, right. As Karthik sir told, overweight or being obesity due to rapid urbanization, especially after this COVID lockdown and this online classes, there is rapid rise of obesity. Obesity will lead to early puberty. The reason being, in obese individual, there is an extra amount of fat, and there is a chemical called leptin, which is a permissive factor for onset of obesity. Apart from this mechanism of leptin, there will be decreased sex hormone binding globulin, which will lead to increased amount of free estrogen in the blood, which will help in attaining puberty. Apart from this, there is another mechanism like increased aromatization of androgens to estrogen. Apart from this, there are other mechanisms like increased activity of increased IGF-1, which will help in the growth, and as well as being obese will lead to early epiphyseal closure, so that they will have increased height velocity, but they attain puberty earlier.
All right, well, let's go to Dr. Karthik. Dr. Karthik, what is amenorrhea in teens and what causes missed periods?
Right. See, amenorrhea basically means amenorrhea, absence of menstruation. So in teens, usually we look at it as two main reasons. One is primary, wherein a child or a girl doesn't have periods or hasn't begun having periods until the year of 16 years, until the age of 16 years. That is called primary. So that is a bit rare, but there are specific causes, certain genetic conditions and ovary related problems. This causes primary amenorrhea. But much more common is secondary amenorrhea, in which the child would have already had periods, but subsequently there might have been irregularity in periods. So when I say irregularity, you must not be under a conception that missing just a period for 1 or 2 months is a major problem. It is definitely not. Generally, it is said that having 8 to 9 periods per year is more than sufficient enough, in the sense that signifies normality. So when do we take it as abnormal? So in a child who is having regular periods, if there is continuous 3 months of absence, or in a child who has already had few irregularities, continuous 6 months of absence of periods is called amenorrhea. So then we will have to look at the causes behind that. These days, again, the majority of children have such secondary amenorrhea, predominantly due to one which everyone is aware of. It's called polycystic ovary syndrome. It is a complex disorder which is a byproduct of overweight and obesity. That is the most common reason, but there can be other reasons in pituitary or hypothalamus, that is in the brain, or there can be certain other problems in ovary which can also result in this secondary amenorrhea.
All right. Well, thank you so much, doctors, for talking to us and answering all those questions and creating awareness about this issue that most parents need to be aware about. Thank you all for watching at home. Goodbye.